My name is Eugene Choi. I'm a hematologist oncologist here at Mercy Fitzgerald Hospital. I see patients of all ages, anything from clotting disorders to anemia, which is fairly common, and obviously for oncology, it's cancer care. So my oncology patients tend to be a little bit older. Oncology is one of those fields that is very involved. It's not only really the patient you're taking care of, but also the patient's family. Obviously, a diagnosis of cancer is a major life event. There's been so much research, so much effort to improve cancer care. So really things change very quickly, and it's one of our responsibilities to be up to date with the newest things. Here at Mercy Fitzgerald, we do participate in research and clinical trials. We're affiliated with the Jefferson medical system and are involved in several clinical trials in affiliation with Jefferson. I think the internet is a wonderful resource. There are lots of good websites that give information in a readable manner that's understandable regarding disease processes, treatments, etc. The only caveat is obviously there are other websites that aren't as accurate. We have patients where they'll read something on the internet or they'll hear from a friend about this new treatment. The big thing nowadays are these homeopathic treatments, and I encourage them to go home, think about it, talk to their family. I try not to discourage it as much, but I simply try to lay out the facts of what I recommend. And if they are going to try that, to obviously remain in close contact so I can monitor them closely. I do encourage to go to the internet, like I said, a lot of excellent resources. And finally, you can always just call the office again and ask to talk to me, and I will get back to you. I actually was born in Camden, New Jersey, and spent most of my life in northeastern Pennsylvania in the suburbs of the Wilkes-Barre-Scranton area. I've been in Philadelphia since the early 90s. On my spare time, I enjoy going to the orchestra, going to performing arts. Philadelphia is a great city, has lots to offer, and spending time with my family. One of the reasons I got into cancer care was because the moment a person is diagnosed with a malignancy, with a cancer, regardless if they're in their 20s or their 80s or 90s, this has all of a sudden become one of the major turning points in their life. And so as an oncologist, I feel a great responsibility toward that individual. I think the oncologist has suddenly become a great part of that individual's life, and it's a great responsibility, but it's a great privilege also to be involved in other individuals in that aspect.